Hello, today I would like to give you a walkthrough demo of one of our product, My Life Doctors, which is a very efficient virtual healthcare program, a telemedicine application which connects physicians from all around the world to patients who need to get in touch with different specialties of the doctors. So patients can quickly get in touch with them, search the best doctors for them based on their reviews and all that, and get the virtual care programs. So this is the landing page of this application. Being a non-user, you can review this landing page. If you need the check the symptoms of the corona, you can get them from here. Then you can see more details about My Life Doctors, different programs. You can book appointments straight away. You can register straight away. You have different subscription plans over here. Our doctors. So let's get straight in, and we log in from one of the profile. Let's say I log in from the clinician file over here. And this will take me to the physician or clinician's dashboard. So this is a test account, so I can see that these are set of slots available which I have created for my appointments, and I can see all of these details over here, all the menu items on the left side. I can see all the notifications on the top. Somebody sent you messages, booked your appointments, referred you to a new patient, or referred a new patient to you, and I can see different messages coming in from different people, from different patients. I can view them from here. If I want to send them a message, I can do that. If I want to attach anything, I can do it. And from here, if I want to initiate a video call with my patient, I can do it from here. So, and also this is a very handy tool over here. If you want to share your profile link to anybody through SMS, through email, through WhatsApp, you can send that from here. So let's get straight in and create some appointment slots from here. So once you click on appointment slot, you would be basically in manage appointments. So when you are in managing your appointments, you have two things over here: create your slots or your list of upcoming appointments. So let's get and create our slots. For creating the slots, we have added two business logics over here. You can select one or multiple days in a different range, and then you can pick a time for the appointments, and you can put availability slots here. Let's say it's 20-minute slot, and you save them, and these would be created. And the other thing is you can create your available slots based on a different range of time. Let's say you have a range of dates selected between 15th to 27th of April 2020, and you can pick a time for your availability time every day between these, and the availability slot would be 30 minutes. So every appointment would be of 30 minutes, and there would be time divided on the 30 minutes. And then you can pick the days from here as well. So let's say you don't want to do the Saturdays or Sundays, so Saturdays and Sundays would be skipped from this range, and if you save it, this is going to be added in that. I'm not going to do it because this is already stuffed. We have a lot of test slots created over here, and we'll go ahead and schedule a call from the schedule appointment from the patient side later on. So let's say once your appointments are booked, somebody booked your appointment, some patient booked your appointment, they are going to be shown here in a different color, red color, with the patient's name on it and date and time. And they would be also represented here in upcoming appointments. You would be having a list of all those appointments booked in here, and you would be able to review them. You'll be having the list view over here, and if you want to see in a calendar view, you can get it from here. So whenever your appointment is booked, your patient is going to redirect it to your conversation. They are automatically added in your conversation here, so the patient can send you a message, send you attachments. Likewise, the physician, they can send the attachments and the messages from here. The only difference is the physician can also start a video call by clicking this join room button. So let me And the next we have is doctor's profile over here. In the doctor's profile, doctor can manage all of his profile details, uh, all of his history, educations, awards and recognitions, any memberships, any licenses, registrations, residency registration number, anything they can add from here. Then the doctors can add their services. Let's say there are orthopedic surgeons, so they are providing different surgeries and different services based on different packages. So it's sort of a packages they can create, so the when the patients are coming in and they are looking up for a doctor, so they can see that what the packages this particular physician is providing, what are the cost of that, and what are the reviews from the other patients coming in. So the algorithm at the back end is, the higher the reviews, the higher the positive reviews of the physicians are, the higher he is going to show up or she is going to show up in the doctor search module. So the doctors, they can create the treatment plans for each of their patients. They can create medications. They can send them those medications to different pharmacies, which are actually added by the patient. So let's say you select the patient over here, or this patient. So we had, probably 7 or 8 sessions with this particular patient, and we can see that the medication provided to them, we can see the frequency, unit, dosage of those medications, and these are the past medications. And now if you want to create new medications for them, then we go ahead, we pick it, we pick the frequency, we pick the dosage, let's say 2 units is there, start and end date. For that you have to take it for 3 days consecutive. Take with proper meal. You are any of the comments the doctors can add from here, and they can save this medication, they can add new medications. So all those medications for these patients, they would be listed over here. You can view from here, and you can download them, print them, and send to pharmacy. So if you click on the send to the pharmacy, you'll be having a list of the pharmacies against those patients. So the patients, when they create their file, they add their pharmacies here. So that's it. We select the green pharmacy, and this is going to be forwarded to the green pharmacy straight away, and also to the patient. So the next thing we have over here is our patient side. On the patient side, the doctors can very efficiently manage their patients. They can add new patients over here. They can view the details of their existing patients, their medications, and they can see the patient's vital signs. So these vital signs are integrated with healthcare smart devices, and those healthcare smart devices are connected with the mobile applications. So once you are taking any readings of through a glucometer, through a pulse oximeter, or a digital blood pressure device, they are going to be automatically populated in your application. So let's quickly get to those. Let me show you those devices we are using. So these are the set of particular healthcare devices we are currently using with our system, and this includes different devices coming from the iHealth here US. That includes pulse oximeters, we have digital stethoscopes, and then glucometers and blood pressure devices, digital weigh machines. Very handy, this otoscope over here. So there are a lot of devices which we have been using connecting with these applications, and getting the vital signs. So the patients, they don't have to add their readings manually every time. They can be connected by their healthcare devices. So then we have the payment module. The payment module is currently done using the Stripe, but in a different system. We are using them using the based on their insurances, and the billing module is there. So we can connect them here anytime, and we can customize it. Then the physician can also create a staff for their clinic. Let's say that they are using this particular application on freelancing and also in the working in a clinic, so they can add a staff who can manage all of their appointments and their slots on behalf of those physicians. So, and then you have this patient referral module over here. So once a physician is looking up to a doctor, so looking up to a patient, and he realizes that through an early chat and symptoms that this patient is not for them, but this patient is for a cardiologist or a other specialist, so they can send them to another doctor. And if this is another doctor, so they would be having these referrals, sent to them, the patient name, doctor who sent the referral, the notes, and the appointments and all that. So the patient don't have to pay twice for another doctor. They would be synced to the right doctor through the referral module within the same appointment payment. And once the physician click on the start chat, this is going to start the chat with that particular patient between those new doctor and the patient. So it's like this. So yeah, okay. Then we have the forum questions. There is a public forum over here in MyLab Doctor. So anybody who is the part of the MyLab Doctor user or not, they can send messages to different specialty in different groups, and those messages would be responded by the doctors, and they would be shown to their particular fields over here. So if you want to answer any of the questions, you can do that from here by clicking from here. Alright, so I will take you to the patient side, and from that side we will be continuing the reviewing how the patient performs. Alright, so here I am logged in as a patient. This is the patient's dashboard, and the patient again can review their notifications coming from different doctors. They can see the public forum, FAQs, blogs, everything which is available to the physician as well. But the major thing over here is they can manage all their appointments. They can see their upcoming appointments with different doctors. I have booked particular appointments using these demo accounts with these doctors over here, and you can review them and see their particular appointments over there. Then again, you have the patient have their vital signs shown here, which are coming in from the different healthcare devices. Patient can see the details per appointments which they have created and gone through, and they can see what they have paid for each appointment. So the track is there for every bit and detail. And then the very the most your feature over here, which is the EMR that can be managed from the managed profile. So the patient can come in and patient can add their personal details, all of the personal details, their guardians, their parents, social details they want to add, they can add it from here. In the medical history, the patient can add all of the details about their health, their past medical conditions, their history, their surgical histories, if it's a lady and they were pregnant, the details of that, if they were hospitalized, everything they can be added from here. So the patient, you can see the past medical history, you can add them. If you have any current diseases, anything, you can add them from here. Current medications, which medications you are taking, you can add them from here. Your social history, you have been smoking, you have been taking a lot of caffeine intake, coffee lover I say, alcohol, or any recreational drugs you have been taking, you can add those values, because being a physician, these things are very important, and obviously you don't like telling people all of these bit and details every time again and again whenever you're going to a clinic or reaching up to a doctor. So having them in place in start, that saves much of the time and the headache as well. So, and then you can also add your exercise history, the details about your current physicians, your family physicians. You can add the details about your surgical history, as I said, pregnancy histories, their detailed pregnancy history, any of the allergies which you have. So we have a kind of the APIs connected with the system. So whenever a patient, when a patient adds their allergies and they are into a virtual communication video conference with a doctor, and the doctor is adding a medication to them based on their symptoms. So if that particular medication is in contrast with some of the allergies the patient has. So the system is going to pop up a message that, let's say, this medicine chloroquine is in contrast with this patient's allergies, so you should suggest a different message, medicine. So this is a certain very handy feature for the physicians to avoid any of the misfortune for the patients. And then you have the pharmacist information which the patient can add, and that is actually being shown to the physicians when they are creating the medication for the patients. And then there are hospitalization information if they were ever, and family history. Let's say the most of the chronic diseases like diabetes, hypertensions, they are inherited from your family. So having those details over here, that makes sense at all. And other details about their, if they're alive, disease or all that, so this can be shown here. And the patient's hobbies and the history, they can be added from here. So this is going to create a complete set of the electronic medical record for the patients, and they can review it, and the doctors, they can also review it. And when they are prescribing them the medicines, or they are going through a virtual healthcare consultation, they can understand the what's happening with these patients, and what's there in their medical record, and what they have to do now. So then patients can add their insurances. They can pick their insurance provider. They can add all the details over here, their insurance ID, so they can be added. And then they can attach different their healthcare reports, their X-ray films, MRI results, all of those results and the reports, they can be added from here. And whatever you have added and saved, they are going to be shown in your view profile section over here. So in your view profile section, here you will be able to see all of those details which we added in that edit section. And then you have this very particular module over here, which is find a doctor. And to find a doctor, obviously you need to know the specialty you're looking for or something like that. If you don't know that, but you know a doctor's name, you have been in earlier conversation with them, so you can just straight away put their name and search for the doctor. So we got the doctor here, and if you want to book an appointment with them, I click on it, and once I click on it, this is going to take me, so once I click on it, this is going to take me to the doctor's profile page over here. I can review it, I can see their services and their reviews, and if I want to book an appointment from here, let me pick up a slot. So I click on book an appointment, and if I add my email ID here, my card number and details, pay some amount, the appointment is going to be booked. And the other thing is we can search the doctors based on their locations and their specialty as well. So if I come down over here and I pick the specialty, any of the specialty, and I can also pick the different locations from here. So state, city, everything I can do that. So the search is very precise, and if the search is very precise and you know the exact doctor you're reaching it, so that's going to save a lot of time to the patients. So this is your upcoming appointments module. Here you will be having the list of all the upcoming appointments for you. You can see your chat history with them by clicking this button. You can see all of the uploaded files and any of the details which are provided. So currently there are no appointments over here, so basically you're going to get all the documentations within this hood. So again, your conversation over here is the same conversation module, and then you have all the prescriptions which are provided to you by the different doctors. So you can see the set of these different prescriptions over here. They would be listed here once they are provided by the doctors. Again, the pharmacies, your pharmacies which you are going to add while creating your profile, they would be listed over here. You have your public forum. If you have asked any of the questions to the people, they are going to be shown over here. And you have your referral modules, and the referral module, you can see that the different your physician have referred you to another physician, so you can see all those history and the details from here. So this is a set of a particular view of the patient side, and if I complete it and summarize it, between the MyLife doctors, again the patient and the physician, they can connect very efficiently. and the physician on their side, they can review patient's profile, their medical history, their backgrounds, their reports and allergies and everything, and based on that they can create particular and specialized prescriptions for the patient that can be sent to the pharmacies, and obviously the patients are going to get the different medicines and medications based on that. So let me summarize it, saying it that this system over here is a very flexible, and the structure is very flexible and solid. We kept in mind the future integrations and the enhancements of the software. So if any of our clients, they want to clone this application and they want to add further features in that, so that's not an issue for us, because the structure, the coding standards, the naming conventions, the databases, everything is following a particular development standard. So if you ever have to make any changes, if you ever have to do some value additions, do some tailoring in the code, some stuff here and there, that doesn't take us time. So if somebody is creating a telemedicine in 6 to 7 months, we do it in 2 to 3 months. The reason behind that is we follow a process which we have in place for quite a long time. So thank you for bearing with me, and we love your feedback. Thank you.